Good morning, Baguio. Good morning, Philippines. Ito ho ang inyong Manang Lucy sa bago nating episode ng Health Matters. With us today is Doc Jo. So today we're coming to you from the Baguio General Hospital and Medical Center, particularly from the Geriatric Care Unit. Doc, can you give us more information about yourself?
Thank you, Ma'am Lucy. And hello, Baguio. I'm Dr. Geohna Perez-Gison. So I am an internist and I had my subspecialty in geriatric medicine at St. Luke's Medical Center, Quezon City. So I recently just came back from my training 2 years ago. And we've started the Geriatric Care Unit, to cater more to our elderly population, most specifically our elderly patients who are already frail or those with known geriatric syndromes.
What exactly does a geriatrician do, Doc?
Kung meron po tayong pediatrician na para sa mga bata, meron din po tayong geriatrician. Yun naman po ay yung another end of the spectrum. So, ang geriatrician po, ang specialization ay para sa mga pasyenteng nagkakaedad na o may edad na. And of course, ang focus po nun are on conditions that are more common among the elderly population or the aging population.
Doc, are there actually common diseases or disorders that are experienced by the elderly population?
Magandang tanong yan, Ma'am Lucy. Kasi hindi porket nagkakaedad tayo, automatic na magkakasakit po tayo. Hindi po ganun yon. Aging only increases your risk from having these kinds of conditions or diseases. Diba, madalas pag nagpapa-check up po tayo sa doktor, ang pinapa-check up natin ay yung ating high blood, yung ating diabetes, sakit sa puso, o yung mga sarit-saring mga arthritis na kung tawagin natin. However, an aging patient or an elderly patient, or as you age, it only increases your risk to have these conditions. Hindi yan automatic na kapag tumanda ka, magkakasakit ka. And also, there are certain conditions that are more common among the elderly. Example doon, yung mga tinatawag natin na geriatric syndromes. Itong mga nakikita nyo dito, no? So, geriatric syndromes are a group of common conditions that are commonly seen among the aging population or the elderly patient. So, example po niyan, yung tinatawag natin na dementia o mas kilala bilang Alzheimer's. Nandyan din ang delirium in the elderly. Meron din tayong elderly depression. Meron ding risk for fall, osteoporosis, sleep disorders, and incontinence, among others.
I'm already 65 and I qualify.
Welcome to the club.
Yeah, and I understand I qualify for the elderly population na. Ako kasi parang may mga forgetfulness na naoobserbahan sa sarili ko, no? Like I walk into a room and then ask myself, ano nga ba yung gagawin ko dito? Is it common to different age groups or early symptoms na po
ng dementia? Magandang tanong yan, Ma'am Lucy, kasi marami kaming patients na yan ang kadalasan na misconception. Actually, being forgetful or forgetfulness is a normal part of aging. Hindi porket malilimutin ka na o yung agkabaw, kung sabihin nga nila, dementia ka agad. Hindi po ganun yon. It only becomes dementia or Alzheimer's, ika nga, if that forgetfulness already affects your daily activity or your daily function. And ang dementia kasi, hindi lang siya sa memory. It is a global cognitive impairment. So, inaapektuhan din niya even other areas of your cognitive function tulad ng attention, concentration, even calculation, o yung kadalasan, yung executive function, or your ability to plan, to judge, and to organize.
So, Doc, why do we age?
Maganda na namang tanong yan, ma'am. Why do we age? Imagine a machine. So, yung mga makina natin, no, habang lumuluma, it undergoes wear and tear. Ganon din po ang katawan ng tao. As we age, we undergo wear and tear. And our body undergoes different physiologic changes, ika nga. There may be changes that are inevitable, kumbaga hindi natin maiiwasan, darating at darating yon. But there are also changes that are preventable. That is why it is recommended that we undergo regular checkups. So consult your doctors regularly, hindi yung kapag may nararamdaman, dun lang magpapa-check up, o kaya go to your physicians as screening din lang po.
So, what age do you recommend, Doc? Kahit walang nararamdaman, dapat bumibisita na.
Of course, sa akin, natin. Sa elderly natin is 60 and above ang ating mga senior citizens. Dapat meron na po yung periodic health check-up.
So, is it a general checkup? Paano po yun?
Makatutulong din po if we check up like kahit once a year man lang. And then your doctor will tell you if there's a need to go regularly or earlier than once a year. Pag wala naman po kasing ibang problema, a once a year check-up is okay. However, if we need to follow up on something like on blood works, o di kaya yung blood pressure, o di kaya yung mga ibang factors like the nutrition, pwedeng as frequent as every 6 months or every 3 months. So it would really depend. But the minimum requirement is at least a year, once a year.
At least once a year. So, narinig niyo po yun as early as 60.
Or kahit hindi 60, ma'am, kahit 55, mas maganda rin po
mas
nagpapacheck
maganda
up
po.
na.
Oo. So, marami pala ring mga disorder or diseases na pwede nating i-prevent, and one way of preventing this is regular checkups. Going back, you mentioned some of these diseases are preventable. So, ang nakikita natin po kasi sa karamihan na medyo malala ang mga dinaramdam when they get old dahil sa abuso sa katawan, di ho ba, Doc? Sometimes it's because of unhealthy previous habits.
Yes.
Na in our old age, naniningil.
Pwede.
So, kung ikaw ay elderly na, ano nga ho ba yung mga pwedeng i-adapt na lifestyle, no? How do you age healthily?
Yan po yung tinatawag nga natin na healthy aging. However, healthy aging is not the absence of disease. Hindi porket may sakit ka, hindi ka na healthy aging. Hindi po ganun yon. Ang healthy aging is, the focus is more on optimizing your independence and functional capacity. And the focus is more on achieving the best quality of life visible. Yun po ang talagang healthy aging. And para maabot po natin ang healthy aging, meron po tayong tinatawag na 5 M's. So you just have to remember the 5 M's, my dear audience. We have mind, mobility, medication, multi-complexity, and of course, what matters most to you. So yun po yung importanteng 5. So una, in terms of sa mind, we just have to have a healthy mind, and we should be mentally active also. Hindi pwedeng lagi na lang tayong tulala at nakatingin sa TV na walang ginagawa. Dapat active din po ang ating isip. Ano pa, hindi lang isip, dapat active din ang ating katawan. So that's the second M, mobility. Of course, if you have maintenance medications, take them regularly. If there are medications that you don't need or those medications are not yours, hindi kailangan inumin. Multi-complexity, syempre as we age, mas nagiging mas complex tayo. Iba yung mga pangangailangan natin as compared to other people who are younger. Pwedeng mas complex ang ating social needs, ang ating emotional aspect, ang ating functional capacity. And we have to understand and accept the complexity that we have. And of course, pinaka-importante is what matters most to you. You can be aging healthily if your focus is on what really matters to you. Like, is it your family? Yung iyong pamilya ba? Your social status? Your independence? Functional capacity? Or is it your spirituality? Yun po yung importante doon.
As an elder, what sort of mobility activities can you recommend for aging people?
Okay, just like what I always tell my patients, as you get old, hindi naman po kailangan na yung exercise nyo jogging, aerobics, o zumba. Hindi naman kailangan ganon. The focus of our exercises or mobility are more on resistance training exercises. So ano ba yung resistance training exercises? These are exercises against a force or against a resistance or against gravity. Example po nun, yung simpleng pagbuhat lang ng weights na 1 pound o kahit yung bote ng tubig na maliit, gaganyan-ganyanin mo lang.
Yung 1 liter, 500
ml, pwede na po yun. O di kaya yung paggamit ng ating stretch bands, yung parang rubber, na binibinat-binat, kasi may resistance. So, ang purpose ng resistance training exercises are for the strengthening and building of your muscles. Kasi as we age, habang nagkakaedad po tayo, lumiliit po yung ating muscles kasi hindi na ho natin siya masyadong nagagamit. That is why we have to focus on resistance training exercises. What else? balance training exercises. So, meron po kaming madalas tinuturo sa aming patients yung para ma-improve yung balance. So, you try to stand on one leg, pero nakahawak ka for 2 minutes. Pag kaya mo na ng 2 minutes, pwedeng 5 minutes, ganyan. Tapos, sa kabilang paa naman. Yun yung balance training. Kasi kadalasan, as we get old, nagkakaroon tayo ng problema sa balanse. Kaya marami dyan ng nahuhulog or na-outbalance.
Tama. So, sa aking pag-iisip earlier was walking was enough. Hindi pala, no? As you heard Doc here, na kailangan may resistance training. At saka may weights din, ano? That's part of the resistance.
Yes.
And then balance training.
Para bumalik yung muscles, ma'am.
Oo. Doc, you also mentioned medication. Normally kasi, yung mga elderly natin, marami nang tinitake na gamot. Yung iba naman, marami ako naririnig na, kasi binanggit nung kanyang best friend na, I'm taking this supplement or whatever medicine. O ako nga rin, sasabihin niya. Can you help us understand further? Tinatawag niyong polypharmacy.
Yes. Okay. Ang polypharmacy, common din yan sa ating mga elderly patients o pag nagkakaedad tayo. Katulad nga ng sinabi nyo, hindi lang doktor ang nagpe-prescribe. Minsan pati yung ating mga kaaruba, ang ating mga neighbors. Pag maganda kay kaaruba, sasabihin niya, uy, maganda tong gamot na to, take mo din. But it's not supposed to work that way. We have what is called polypharmacy. So some literature would define polypharmacy as the number of medications, like having 9 or more medications. Polypharmacy na daw yun. Kaya lang, medyo mahirap atang abutin yon, especially for patients na maraming sakit. Siyempre, pag marami kang sakit, marami ka ding gamot. It's best to understand polypharmacy in the context na you're taking medications or more medications that are than what are really needed by you. Kumbaga, hindi mo naman kailangan or walang indication, you're taking it. Just because your neighbor or your sister or somebody close to you said that that medication is good, iinumin mo na. So that is polypharmacy. Taking medications that are not supposed to be taken by you because they are not needed. Ganun po siya.
Okay.
In addition, polypharmacy includes not only medications that are being prescribed by doctors. Polypharmacy also includes over-the-counter medications, yung mga bili-bili natin for simple cough and colds. Or, kasama din po dun yung mga herbal medications. So, anything that you take in, that is part of polypharmacy.
So, that would include supplements, Doc? Vitamins?
Yes.
Anong recommendations for individuals? This is not very common, but there are some elderly people also that may not be taking in maintenance meds. They have remained healthy, but are actually taking several kinds of supplements.
Actually, Ma'am Lucy, marami po kaming pasyenteng ganyan. So, wala ngang high blood. So, wala siyang maintenance sa high blood. Wala din siyang diabetes. So, wala siyang maintenance sa diabetes. Maganda din ang status ng puso. Kaya lang, ang kanyang supplements o kanyang vitamins A to Z. Yun naman yun. That is still counted as polypharmacy. Actually, ang talagang may basehan lang po in terms of the supplements that you need as you get older, 3 lang ang talagang kailangan natin. One is calcium, and then we have vitamin D, and then vitamin B or boy. Yun lang po talaga yung kailangan. Kasi as we get older, these substances are not absorbed that much already. Hindi na natin kailangan ng mga ibang vitamins and minerals, ika nga, as long as you're eating healthy or you eat a lot or you can eat. Kasi may mga elderly patients po tayo na medyo kulang ang nutrition. That is why you need to supplement the others. But if you're eating right, you don't have any problem with your meals or eating, hindi mo na kailangan i-supplement yon. Ang kailangan mo lang talaga yung 3. So that's calcium, vitamin D, and vitamin B. Now, madalas po tinatanong sa akin or sa amin, no? Doc, paano po ako naka-vitamin C ako o naka-vitamin E? O di kaya meron akong zinc, mga ganon. Hindi naman po bawal yon. Pati yung mga naka-omega 3, mga naka-collagen. Hindi po siya bawal. It's not prohibited. However, it is not needed. Katulad nga po ng sabi ko kanina, polypharmacy is taking medications that you don't really need. So kung madami ka ng gamot, huwag ka nang magdadagdag nang hindi mo na kailangan.
So there you have it, tayong guilty dyan. Kasama na ako doon. But going back to vitamin D, I've been hearing from a non-doctor like me, as I age, I observe that sleeping is becoming an issue for me. Ang sinasabi dyan, if you don't get much of it, will taking in vitamin D help me have better sleep?
Vitamin D, wala po siyang studies in terms of helping with sleep, ang vitamin D.
Okay.
However, sleep disorder is one of the geriatric syndromes that I mentioned earlier. Two-thirds of our patients who go for consult complain of sleep disorders. Kung minsan, hindi na nga nila minimension, pag tinanong mo, sasabihin sa'yo, ay, oo nga, Doc, medyo hirap po akong matulog. And it is also a misconception na as we age, sinasabi nila, decrease na daw ang need for sleep. No, that's not true. Actually, studies would show ang target dapat natin ng tulog ay 6 to 8 hours. However, if you have at least 5 hours of continuous sleep, okay na po yun. Itatanong mo, Ma'am Lucy, so sabi mo, Doc, kasama siya sa sleep disorder, so it is a common occurrence as we age. Yes. Bakit? As I mentioned a while back, because of the different physiologic changes that our body undergoes. At saka, syempre, kasama din po doon yung decrease ng physical activity natin. Syempre, when we were younger, paggising mo pa lang ng umaga, iniisip mo na yung gagawin mo all throughout the day. But as you age or as you get older, kuminsan yung activity natin becomes lesser or very minimal. Syempre, katulad po ng lagi kong sinasabi sa mga pasyente ko, paano mo i-charge yung cellphone kung hindi naman na low-bat? So, kailangan malobat ka. Kailangan you're mentally active and you're physically active so that when it's time to sleep, when it's time to charge, matcha-charge ka kasi low-bat ka. Parang ganun po yun. Of course, kasama pa rin yung mga physiologic changes of aging. So, kailangan din natin i-address yung mga yun.
So, given that, Doc, that it's a common occurrence in elderly people, of
Yes.
course, may limitation na rin po yung ating mga katawan na elderly, pero
Yes.
ano ba yung realistic na pwede nating gawin?
Siyempre, I said a while back na kasama nga siya sa syndromes, no? It's a common occurrence. Pero hindi po ibig sabihin nun na kaliwat kanan din ang inom natin ng sleeping pill. Hindi rin po ibig sabihin nun na kaliwat kanan ang inom nyo ng melatonin. Kasi that will increase your risk for having dementia or cognitive impairment. Ang focus dapat natin are more on the non-pharmacologic things that we can do to address sleep disorder. So, ano yung mga non-pharmacologic? We have sleep hygiene, we have sleep restriction. So, yung mga yon in detail, pwede po namin i-discuss sa inyo when you go for consultation. So, ano ba yung sleep hygiene? So, this would refer to practices or habits that you could do para at least mas mag-improve yung ating sleep. So, ano po yung examples nito? Number 1, coffee. We know for a fact that caffeine is a stimulant. At the same time, diuretic din po siya. So, bawal ba siya as you get older? Of course not. Alam kong maraming nagbubunyi sa inyo. Pag nakakaedad tayo, hindi po bawal magkape. Pwede po. But, when you take your coffee, dapat hindi po siya lalagpas ng 3 or 4 p.m. Para yung stimulant effect po niya, hindi po siya mag-extend hanggang bedtime. And, of course, syempre, wag natin gawing tubig ang kape. So, ang kape lang dapat natin, mga 2 to 3 cups per day lang. Hindi naman lalabis, hindi sobra-sobra. Ano pa? Water intake. Syempre, you have to understand also that our urinary bladder, hindi nakapareho yan when we were younger. So, kuminsan, mataas yung natitirang ihi o yung residual volume. That's why if you take plenty of water or plenty of fluids, ang tendency, gising ka ng gising para umihi. That's why, kasama po sa sleep hygiene, we tell our patients na kapag paggabi na, wag nang masyadong maraming iniinom na tubig para hindi po tayo gising ng gising para umihi. Another part of sleep hygiene is avoid daytime and afternoon naps.
Alright.
Why? Kasi, pag ang haba ng tulog mo sa umaga, ang haba ng tulog mo sa hapon, tutulog ka pa ba sa gabi?
Hindi na.
Wala ka nang ginawa kundi matulog ng matulog. So, naps are there because they are naps. Meaning, they should not be longer than 15 to 20 minutes. So, kasi, pag lumagpas ka ng 20 minutes, lalagpas ka na doon sa tinatawag natin na REM. So, hindi na siya nap. sleep na po yun.
Mhm.
So, iwasan po natin yun. So, these are just examples of yung tinatawag natin na sleep hygiene.
Going back ho sa 5M's, ano po, the last one particularly po, the one that says what matters most to you, no? In your practice, Doc, ano yung pinaka-dominant na nakikita nyo sa mga elderly patients nyo na pinapahalagahan nila the most?
Surprisingly, independence. So, they will kaya natin siya kasama sa healthy aging kasi what matters most to you is what's gonna make you healthy.
Mhm.
So your efforts, all your activities, your goals are towards what matters most to you. So just to give you an example, if independence is the one that matters most to you, then you have to engage in activities that will ensure your independence. Like, syempre, dapat nag-exercise ka para panatiliing matibay ang mga muscles mo.
Mhm.
You take your medications regularly because you don't want to get sick.
Mhm.
Kasi nga, you value your independence very much. So, ganun din po sa kanila. So, that's an example.
Mhm.
What matters most to you. Another, if what matters most to you is more of your spirituality, so okay lang kahit bedbound ka, kahit wheelchair-bound ka, as long as you can attend your church or you can read your Bible, then that is what you will focus on. So that is healthy aging. Iba-iba po yan, depending on what matters most to
To
you.
the person.
Yes.
Hindi ho lahat ng mga elderly na kagaya namin ay maganda ang sitwasyon. So ang tanong ko, Doc, ngayon ay ano yung mga pwede nilang i-access na assistance from the government or from other private entities na kung saan they could still address these 5Ms?
Actually, ma'am, syempre dito po sa Baguio General Hospital, this is a government hospital. So, they can go for their medical consultation here.
Mhm.
Meron din pong bagong mga programs ngayon. This is in relation to the universal healthcare. Meron po tayong tinatawag na PhilHealth Consulta where there are consulta packages or units here in our city who offer consulta packages for our patients who require laboratory examinations or who require consultation. They just have to inquire from their nearest barangays, tanungin kung kasama po yun sa consulta package or consulta assistance.
Oo, kasi sa karamihan naman na ng mga barangay dito sa Baguio, may may rural health unit.
Yes, they're already equipped.
Yeah, and they have doctors there that are frequently
Yes.
reporting there na pwede nilang lapitan. Napakaganda po yung, in fact, nakikita ko po nga yung na-appreciate ko ngayon yung mga government programs pertaining to health, like the expanded PhilHealth coverage. At saka lahat po tayo na nagkakaedad ng 60, if you're not employed anymore, automatic lifetime membership na
Yes.
po tayo, no? So may mga privileges din, Doc, na yung zero
No balance billing.
yeah, no
Yes.
balance
Pag na-confine.
sa mga nako-confine. And then, Doc, baka gusto nyo ring i-announce sa kanila that you have this
Adult daycare.
adult daycare. Kung tayo ay may daycare center for our young children. Doc, would you like to tell them about that?
The adult daycare is a regular activity that we have here po sa Geriatric Care Unit. It's for elderly patients diagnosed to have mild to moderate cognitive impairment. Kumbaga, merong dementia.
Mhm.
So, we do that once a month, every last Friday of the month. Pero syempre, hindi po pwedeng walk-in. We have to assess, no?
Mhm.
Kung ano muna yung extent ng cognitive impairment. So, it's an avenue where they can interact with each other. So, madidevelop yung kanilang social skills. Syempre, mentally stimulating activities by virtue of the arts and craft that they do, the games, even the singing. Tapos, syempre, kasama din po dun yung physical activity. So, they have stretching, they have dancing, ganun po yun. It's just about 2 to 3 hours once a month lang naman po siya. And it's free.
Yan. Okay, so you heard it. Kayong mga kasamahan kong elderly people dyan or mga caregivers
Na meron
na merong inaalagaan may symptoms ng dementia, you please visit our doctor here dito sa Geriatric Care Unit ng BGHMC or Baguio General Hospital and Medical Center. So with that, we end these discussions on geriatric care. So thank you,
Thank you,
Doc,
Ma'am Lucy.
for this time with us.